talk about in terms of the Tommy Douglas vision of healthcare delivery. Our ability to do that, to bring various professionals into the system and to break it down more and give people more access and not have it primarily focused on a medical doctor. Not that the medical doctor is not an important part of it and very strategic in the way we do what we do. We all want our doctor to be involved in our health care because they're the one with the largest knowledge base. However, other professionals in collaboration with the physicians can and do provide expedient and cost-effective healthcare delivery, and we have a sense of that, and we have a commitment to that by the people who work here. So we need to move that agenda forward to make healthcare delivery models more understandable to the larger population, and including professionals to appreciate why this is a good way of doing things.
As a partner in the healthcare service delivery system for Capital Health District, we're very enthused and pleased about the alignment we have and that we've practiced with Capital District's recent 5 strategies. And certainly we've demonstrated an ability to empower and engage our community, to have that accountability with our public, to have a highly motivated staff who are capable of developing programs, focusing on the needs of our constituents. And a big piece of it, of course, from Capital's perspective, is their sustainability. And we've got that well in hand after 38 years in operation. All of the client visits and all of the client programming we do does in its own way take pressure off Capital District. So the model we practice, the model we have in place is something that is a good news story for the Capital District Health Authority, and certainly a good news story for the residents, the constituents of North End Halifax.
The implications of the work done at the Community Health Centre are huge. The focus on the prevention of illness, the management of chronic disease, the addressing of the social determinants of health result in fewer hospital admissions, shorter admissions, fewer interventions, and ultimately save our system millions of dollars.
When I came to work here 24 years ago, and I planned to stay a year, and here I am 24 years later. Again, for me, it makes sense in terms of spending public dollars because I think it's an effective and efficient way to deliver health care that's targeted to your population. Because it's based on social determinants of health, I think in the long run, when we look at the epidemic of chronic disease and obesity and diabetes, I think this is the model that is going to change the future to make our healthcare system more sustainable. And it's also, it changes with the changing needs of the community. So, as things evolve and change, we have either new technologies or this issue becomes no longer important. Our way of programming changes with that. So it's actually a very flexible model too. And you can bring in whatever team members you want, depending on what you need. So it's a very flexible model. The challenge is it's new money into a system that doesn't have a lot of money. And it's the shift over that's hard to do. And until we start shifting money from acute care to primary care, it's going to be a challenge for other parts of the province to institute that. Most of the ones that are in existence have been generated out of community need. You've had some champions in the community say, we don't have adequate care, and they've developed a little community health center. And it could be as simple as a physician part-time and a nurse. And now they're working together, whereas before, the real access was to physician services only and nothing else.